an abnormally high body temperature, the normal being 98.4 degrees F or 37 degrees centigrade, is known as fever. There are so many diseases characterized by an abnormally high body temperature. They have got their own names. The treatment is decided upon by referring to the accompanying symptoms like periodicity, chill, shivering, digestive complications, body pain and headache. In this video, we will take up 3 such symptoms. One is burning, the other is chill, the third is night sweats. An infection by carriers of disease is met with resistance by the white cells by surrounding the former. The blood cells signal the brain, which in turn activates the thermostat of the body situated in the hypothalamus. The body is ordered to raise the temperature and the human being begins to shiver. Shivering being movement generates heat. The blood vessels near the skin surface become narrow so that the heat loss is prevented. The fat stored under the skin breaks down and provides further heat. A shivering patient is covered with heavy clothing that helps in further raising the temperature. When the body temperature rises, the defense mechanism operates more efficiently. That is how nature has organized the show. This is true of mild fevers which do not last long. However, when the temperatures exceed 40 degrees C or 104 degrees F, or if a child under 1 year runs a high temperature, get immediate medical assistance. It is an emergency. Further, fevers lasting beyond 3 days in adults too require medical consultation. A patient running a temperature must rest and take proper medication. He should stay snug and warm. He should take a light diet and plenty of cool fluids. We take up burning first. One of the common symptoms during rise of temperature. If the burning is felt in the brain, in stomach, in bladder, in lungs, there is an acute sensation. It can be in malaria, typhoid, last stages of pneumonia. There is a nightly aggravation. The medicine required is arsenic Alp 200. When burning comes accompanied by high fever, the body burns pungent, steaming hot. The patient is not thirsty although he is burning. Belladonna 200 is the medicine. Mark the high fever and the pungent, steaming hot condition of the body. The patients who have frequent violent flashes of heat through the entire body, it may be related to any malady, they require sulfur 200 to get relief. Sulfur 200 should be given once a day for a few days. The next symptom important in fever is chill. This is the opposite of burning. Entire body is ice cold. The tongue is cold and trembling. Mark this symptom. This is so specific. The pulse is weak. Give camphor 200. CAMPHOR 200. In cases of periodic chill with clear-cut stages, in malaria, in typhoid, China 200 is the remedy. When there is chill along spine, in cases of influenza, the chill is accompanied by body pain, shivering. Gelasium 200 gives immediate relief. GELSEMIUM 200. When the patient suffers from persistent profuse perspiration, foul smell, skin is ever moist, there can be gastric fever also, not necessarily so. Give Merck Sol 200. You are guided by persistent profuse perspiration. Cases of periodic chill which occurs at 10:30 am. It starts in extremities which turn blue. There is a throbbing headache. The teeth chatter, bones ache, the fingers feel scorched. There is no thirst during fever. The mucous membranes dry. Otherwise, great thirst for cold water. The patient rolls from side to side. Malarial or any other fever with periodicity which comes at a fixed time. And where sweating relieves fever and ache. The medicine is Natrum Mur 200, NAT-MUR 200. In inflammatory or periodic fevers accompanied by sore throat, gastric disturbance, rheumatic inflammation, spasm with rigor in the morning, where the fingernails are blue, give Nux Vomica 200. The patient feels chilly on being uncovered, but he cannot stop covering. He must be covered in every stage of fever. When the patient has chill with extreme coldness and sweat, cases of cholera, gastroenteritis, rice, water stools, nausea, uncontrollable vomiting, collapse. The medicine which comes to immediate rescue is Veratrum Alb, VERATRUM-ALB 1000. It seldom fails. I have not seen failure. The third symptom which I am taking up in this video is night sweats. There is a sudden high temperature with profuse cold night sweats. Give acetic acid 30. When the children get night sweats on the head, mind you, head, Calcarea Carb 30 is to be used. In cases of profuse perspiration, the fever is debilitating. It can be malaria, it can be typhoid, which would be discussed separately in different videos. Where the fevers are coming with marked periodicity, with night sweats, China 200 is the remedy. Periodicity attracts China for cure. Cases of copious perspiration without relief, a sense of creeping chilliness. The fevers could be gastric or bilious. Merck Sol 200 is to be used. If the patient is having a snoring respiration, you can hear the sound. The limbs are twitching. The patient is in a stupor. He is not alert. His senses are dulled. Use opium 200. OPIUM 200. Fevers are frightening, but mostly they are easily curable. A fever, a high temperature represents or indicates some problem with the body, certain part of the body. It can be due to infection of the throat, sometimes infection of the ears. It can be due to gastric reasons. So we go by symptoms. We'll be taking up different fevers which have got specific names later on in the other videos which will follow. But for the time being, three main symptoms, burning, chill and night sweats, have been discussed, because one of these symptoms will be there in every fever. Which one I can't predict, but it does go with particular fevers where they have their names. Thank you for listening to this video. Listen carefully, choose wisely. There is no reason that you will not have relief. Thank you for this visit.